Why did you ask my ethnicity?
Are you aware they developed it so fast because they want to test it out on people of African descent first?
Look, you've never bothered about anything else. Why are you coming to talk to us about the vaccines?
My name is Shoba Poduval. I'm an academic GP and health researcher at University College London. Black and Asian people are more likely to die from Covid-19 and less likely to be vaccinated. This has the potential to worsen health inequalities that already exist for these communities. Previous research has emphasised the role of wider inequalities in vaccine mistrust, including socioeconomic disadvantage and exposure to and anticipation of discrimination. The motivation for this research was to improve the understanding of Covid-19 vaccine confidence and factors influencing confidence in low uptake ethnic minority groups in London and the surrounding areas, with a particular interest in social factors which influence decision making, including education, employment, income, and experiences of racism. This research study consisted of focus groups and interviews with people from ethnic minority, non-white British communities. Interviews and focus groups were conducted online from December 2021 to March 2022, following the rollout of the vaccine in the UK in December 2020. Focus groups and interviews were conducted with 14 members of the public. 8 interviews were conducted with professionals from Covid-19 vaccination campaigns. This is what people told us based on their lived experiences. The voices are those of actors and not of the research participants themselves.
The problem with me is that they said, if you've got underlying health conditions, take the vaccine. It's going to protect you. Then, when you hear a story about people dying of the vaccine and they said no, they look at the vaccine, but they had all the underlying health conditions. That's why they died. But surely the aim of the vaccine is to protect them so they don't die. And if they're going to die, they might as well not have had the vaccine, you know? So, I don't know. It's kind of complicated.
So I did quite a few webinars and actually did a face-to-face event with young black people in August 2021. And that was, again, really interesting. Young people with their parents came in and there was quite a lot of anger around. You're coming to talk to us about this vaccine? First of all, just concerns about the vaccine and actually that it was going to harm people. But actually more than that, someone stood up and said, "Look, you've never bothered about anything else. Why are you coming to talk to us about the vaccines?" And I think that's why I got involved in that. I thought it was a good opportunity that if we can really reach into underserved communities for this, then there should be no reason why we can't do the same for other health conditions, whether it's long-term conditions or childhood immunizations.
I had one woman early on say, "Why did you ask my ethnicity?" And I said, "So we can make sure it's equally distributed." And she looked at me and I was like, "Do you think there's a white cupboard and a black cupboard?" She was like, "Yeah, basically." And told me a story of a friend of hers who was also black, who was a carer, who had a person she was caring for who was white. And so she had her vaccine because it came out of the same vial. So I think we have to be really respectful now, in particular of people's decisions.
For me, it's not about information. It's about how comfortable you are with putting something into your body. I'm thinking about it, but I'm actually thinking to myself, I'm ready to leave the NHS rather than take it. Because it's that serious where they're giving you this ultimatum that you take it or you leave your job.
There's about 3 or 4 of us sometimes. We're like little old ladies standing on the landing talking about all sorts of issues and the COVID and the vaccination and, And I think out of us, only one's had it, And the rest of them has the similar feeling that I've got, you know what I mean? We just talk about the same thing, and the way I say I feel, that's them as well.
It may be possible to improve confidence in Covid-19 vaccination for some people by using culturally appropriate and accessible information via community organisations. However, the accumulated morals, views and attitudes and the structures that shape them, including political and medical authority and racial inequality and racialised social environments, are less amenable to change through information sharing alone. Recommendations from the research address social factors that contribute to ethnic health inequalities and include improving ethnicity data collection, more open dialogue about vaccination from healthcare professionals, more funding for clinical conditions disproportionately affecting ethnic minority communities, greater transparency in the vaccine development process, and better representation by ethnic minority communities in clinical trials. These findings and recommendations have been shared with research and policy stakeholders via a UCL Future Vaccine Manufacturing Research Hub workshop. My name's Shoba Poduval and I'm the lead researcher. It was important to me to share the findings from this study in multiple formats to make it more engaging and accessible to the public. I contacted a local creative arts college in East London and met with Kieran and Tamoy. And I've really enjoyed having their ideas and expertise and working on a shared project as a team together to produce multiple outputs. And what I've learned is that the creative process can take a long time, often much longer than you expect, but to acknowledge that it can outlast the research study timeline, that's okay, and to just plan and prepare for that with future projects.